So during the pandemic, we've seen a significant increase in accidental drug poisonings. And, I believe there's all sorts of reasons, I'm sure, but a few things that I know. The accessibility to their substance of choice has been really difficult for some. So for some people, they may have used prescribed opiates, not being able to access those any longer for a number of reasons, but built up a physical dependence to the opiate, and then turns to fentanyl. I've mentioned before people that had been not using substances in recovery for a significant amount of time, and then kind of falling back to ways of coping that were familiar, and perhaps not fully understanding the risks of the potency of fentanyl. We see the challenges with the borders closing and all of the things. So really, like the basically the old ways of bringing over drugs was changed. And so like in reality, what we see is a lot of people ordering things online, yes, it gets here, and then you have people that are essentially playing chemist and making poison, and it's really understanding that it's synthetic. It's not fentanyl. It's not prescribed. It's not a patch. It's not a pill. This is synthetic, and it's so sad to see, someone, experience drug poisoning when that wasn't even their drug of choice. So, we see accidental drug poisonings happening from, use of crystal meth, of cocaine, of crack, because there's significant traces of fentanyl in it. And so all of these result in overdose death or near, and it's just increased significantly. And yeah, I think that, it's, people are in pain in different ways throughout this pandemic. And there's a constant fear of what if, blah, blah, blah. And walking around with that, and there's an increase in housing. I was going to say affordable housing. I mean, just housing in general. We see a huge increase in people experiencing homelessness, having to utilize shelters, having mental health issues, not being able to access medical help. So, everything kind of just snowballs, and it just builds into something that looks like this.